So when I started practicing as an attending physician in 2001, the only patients we screened for hepatitis C were those of the baby boom generation. Why is that? Well, hepatitis C wasn't identified until about 1992. And so those of the baby boomer generation had already become adults and may have received blood transfusions, may have received operations where blood was used that was tainted. And so initially, before we knew about hepatitis C, there was a whole generation of people who could have been exposed. Just ask your doctor, have I ever been tested for hepatitis C? If not, can I be tested? And your doctor will say, sure. Sometimes people might have gotten tested and it was negative, but now they have one of these risk factors like HIV or chronic liver disease. If you have chronic liver disease from anything, you still may be at risk for getting hepatitis C. Folks who had substance abuse problems, who might have injected drugs and shared needles, were also at high risk for hepatitis C because we didn't even know what hepatitis C was. And so the baby boomer generation was paid the most attention to when it came to hepatitis C. After a period of decline in terms of hepatitis C being a problem, it started to tick up again in 2005. As the opioid epidemic took off, patients who were younger, millennials actually, started to, unfortunately, inject drugs. This raised their risk for hepatitis C. Hepatitis C was dropping, it was beautiful until 2006, and then it started rising, and it's all millennials. So I'm Gen X, we're like nowhere, we're like 20%. So it's a third baby boomers, third to half, and then a third to a half millennials now with hepatitis C. And that's why they changed the recommendations from initially being just the baby boom generation to everyone over 18. It paralleled the opioid epidemic. We used to see baby boomers as the generation with the most hepatitis C, but we've seen a shift around the last 10 years where now the millennials have the highest rates of hepatitis C. It's really important to know if you've been tested for hepatitis C. Don't be afraid, ask your doctor. If you haven't, they can test you right there. There's a very simple way to diagnose acute hepatitis C, and that's just by getting a blood test. These blood tests are easy to do, they're inexpensive, they're always covered by insurance. If we pick up acute hepatitis C, we can get you into treatment, which can be very brief, about 8 to 12 weeks of treatment with pills, and it's highly, highly effective.